next. A law restricting abortion rights is still tied up in the courts. Back in 2019, Georgia's Governor Brian Kemp signed a bill that would basically ban abortions after 6 weeks of pregnancy. Last summer, a federal judge struck that down. The state appealed, and now the U.S. Court of Appeals delayed its decision pending the outcome of the Supreme Court case. Joining us now is Dr. Julianne Birt. She's president of Radiant Women's Health in the Atlanta area. Dr. Birt, welcome. Good to have you with us.
Thank you for having me.
If this law that's now tied up in litigation prevails, if it stands, what would that mean for your practice and for the women you serve?
The heartbeat bill has, since 2019, been a hard pill to swallow. We know as gynecologists and women's health specialists that oftentimes women don't even know that they're pregnant until well after their first or second missed menstrual cycle. So for my patients and for the community at large, this is a huge disappointment because our patients oftentimes, for whatever reason and for various reasons, may consider terminating their pregnancy. And so it's really disheartening because the conversation is now no longer just between my patients and myself. I have justices in the room. I have other ears in the room, and that's just not right.
Georgia's maternal mortality rate is higher than the national average. Approximately 29 Georgia women per 100,000 live births die from pregnancy complications. The national average is about 17 women. So I can imagine that if this law prevails, it would have some very serious real-world impacts. Tell us a bit about the clients that you serve, the people who would be impacted by this. What walks of life do they come from? Are there any demographic trends among them? Describe your patient base to us.
Right. So my practice is on the outskirts of Metro Atlanta, and I take care of women who are well educated. I take care of women who have a high school diploma. I take care of women who, make six figures, and I take care of women who, rely on assistance from our government. So, I'm also a part of of many groups and organizations, and namely the National Medical Association. And I'm thinking, Joshua, we are convening in Atlanta this summer in about 30 plus days. And that organization, our goal is to help not only physicians who are made up of African descent, but the patient population, the patients who are underserved, they are underrepresented, they are, they either lack health insurance or they just don't have enough health insurance. And in the state of Georgia, you may know that there are more than half of our states don't have appropriate care for the obstetrical patient. So now we're going to add another burden on top of that, another burden on top of that. And, it really is, a difficult time. I remember when I heard about the leak last month, that whole week was difficult for me because I just kept thinking about my patients. And
Yeah.
unfortunately, people think about patients using or abusing, this procedure, this medical surgical procedure, and they don't think about the other women. And it doesn't matter her reason. It doesn't. And as a woman, I am offended that someone else wants to come in the room.
Right, right. I know I got to let you go in a second, but I've spoken to a number of anti-abortion activists over the last week or so, and several of them have said that they believe that this is an opportunity to provide women a broader array of prenatal counseling, whether it's adoption services, counseling them through how to decide to expand their family, possibly even donated services to help with some of the costs of caring for children from infancy to even the first few years of their life. Do you see any room for that, or does your service provide that now? Is there any room for that kind of service provided that Georgia's law perhaps takes effect?
Oh, I've already warned my staff that our doors will probably be, get knocked down because, patients, I have a vast array of age groups as well. And I do still service the young women, but mostly women in their 20s are the ones who opt for terminating a pregnancy. But there was a study that I just looked at out of the University of California, San Francisco, I believe, and it shows what we've been taught for 20 years, and that most women do not regret their decision. And I was a teacher before I was became a physician. I educate my patients at their wellness exam. It's an opportunity. We talk about reproductive health. We talk about sexual health. We talk about trying to protect against sexually transmitted infections and unwanted pregnancies. But it is still her body, and it is still her choice. So yes, there an opportunity is there, of course. Um, but it's almost as if they're saying that we